All right. Hello and welcome, everyone. My name is Allison Lyon. I'm the Assistant Director of New Student and Family Programs at Georgia Southern University. And we are so excited to have you joining us this evening, or if you're watching this recording later. But this evening, we have a great session for you all on health and wellness. And I think more now than ever, we need to hear about how we're supporting your students at our institution and making sure that they're focusing on their health and wellness during all of their endeavors at Georgia Southern. So before I'm able to share who we have with us on our panel today and let them talk to you a little bit, I want to do some housekeeping and also talk to you a little bit about parent and family programs, because of course I would have to do a shameless plug before we get started. So if you aren't already familiar, on the Georgia Southern website, if at the very top right you select parents and families, there is a world of information for you, wanting to make sure we have all the information at your fingertips in case you have questions as your student is going through their experience at our institution. If you look on the left-hand side, you'll see some quick links. There's a lot, but the two that I want to highlight. The first one's actually the last one that you see currently on your screen, and it talks about family events. So this semester, by participating in these Zoom sessions, we were hosting these because we weren't able to do a family weekend in person this semester due to COVID-19. However, now we're looking into our spring programming and what offerings can we have if we're able to do in person or virtually. And we will make sure to update that website, as this is actually our last event of the semester. So we're going to go out with a bang. So definitely take advantage of looking at that. We're also on Facebook as Georgia Southern Family Programs if you haven't found us. So make sure you give us a like and a follow, because we're trying to talk to you on there, and we'll do some Facebook Lives and connect with you that way. And then last but certainly not least, if you're part of our family, parent and family association, welcome. But if you're not, we would love for you to join us, making sure you take advantage of some of the perks of local discounts, getting a monthly newsletter, and having the opportunity for your student to be eligible for scholarships by being a member of the Parent and Family Association. So definitely click on that link to learn a little bit more about what we have to offer. So now that I'm done with my shameless plug, you're going to be hearing from actually 3 of our different departments of Georgia Southern today, and I'm going to let them introduce themselves. But to start, I'll let you know who we're going to be hearing from. So we'll have Student Health and Wellness Promotion. We'll be having our Counseling Center, as well as our University Medical Director. And so getting to hear a little bit from them, and then also having time at the end for a question and answer. So let's talk a little bit about how you can engage with the panelists today. So our panelists, as they're presenting, if you have questions that are on your mind or that you would like for me to ask to our panelists, you'll see the Q&A feature at the bottom of your screen, and you use that to submit all questions. The chat feature, which you've always already seen hello from Shivani Patel, our graduate assistant, she'll be in there sharing any links with you of what our presenters may be speaking about that she thinks could be helpful to you in the future. But remember, questions, make sure that they go in the Q&A feature of the Zoom session. So without further ado, I'm going to stop sharing my screen, and we're going to get started and let our first speaker introduce themselves from Student Health and Wellness Promotion.
All right, you all, welcome. I'm Dr. Gemma Skuraton. I'm the Director of Student Wellness and Health Promotion. I'm also a triple Eagle. I did my undergraduate degree at Georgia Southern, my master's, and my doctorate. So I have a unique perspective both as a student, alumni, and now director of our brand new office. Student Wellness and Health Promotion was actually just established in January 2020. So I think that sends a great message to our campus community that we value well-being and prevention services. We were previously 2 different offices that reported to our rec center and our health center. So now we are our own office dedicated to prevention and well-being services. So all of the information that I'm providing to you, you can find on our website, which is georgiasouthern.edu /
Gemma, I think you froze. Hold on one moment. We'll see if we can get her back.
With the users, that's me. I'm Dr. Caldwell. I'm the Executive Director for the Counseling Centers at Georgia Southern. We actually have counseling centers located on both of our larger campuses, one in Statesboro and one on the Savannah campus. I'm going to share with you our, I think I'm going to share our website. That's what I was trying to do. Okay, share with you, this is our website. And so the reason I wanted to pull this up is because we really utilize our website as a live resource. So our website is updated on a weekly basis. And not only does it explain to you all of the services available to students here at Georgia Southern in our counseling center, but it is also the portal that students can use to access telemental health treatment, which since the start of COVID is kind of how everything has been going in the mental health world. But a little bit about what your students can access here. We are a full service mental health treatment center. So we offer all of the things that typically come to mind with mental health treatment: individual counseling, group therapy, as well as relationship therapy. We run about 10 to 15 different topic therapy groups every semester, so there's usually something for everyone. And while students can be a little bit hesitant to try group therapy at the beginning, pretty much universally, they end up falling in love with it. It's a great way for students to form really meaningful connections with their colleagues around a common topic that they all might share. For students who aren't sure if they want individual counseling or if they have just a brief question they needed to consult with, every day we have same-day solution sessions available. Students can call when we open in the morning and schedule a session with one of our counselors that same day to be seen. And from there, they can talk about whether they'd like to continue into counseling or if they had all of their needs met at that one-time thing. We also offer a whole series of drop-in workshops. They can all be found here on our website, and the website is how students join those. So you'll see listed some of the topics that we've been offering this semester. So each of these is offered at least once a week. Mindful yoga tends to be our most popular and is offered twice a week. And if students wanted to attend, all they'd have to do is go to the website, click on the drop-in workshop that they're interested in, and the link for the workshop will go live when it's time for the workshop to start. So this is a great way for students to be able to kind of dip their toes in the water, check out some skill building sessions, or connect with other students. Now, so in addition to mental health services, our drop-in skill building workshops, we also have case managers available in each of our centers. So our case managers are great resources for connecting students to services they may need out in the community. They have relationships established, whether a student has food insecurity issues or short-term housing needs, or they are interested in a type of treatment that we don't provide and so would like to connect to a treatment provider in the community. Students can schedule a case management appointment, usually within 24 hours of calling, and they'll be able to sit down with our experts who will not only kind of show them their options for whatever they're looking, whatever type of service they're interested in, but will actually help them set up that initial contact or that initial visit. I should say all of the services at the counseling centers on both campuses are completely free to our students. So we don't ever charge for anything. Students don't have to have a health insurance. We don't bill health insurance for those services. Because of that, we do have a session limit. Students have 16 individual counseling sessions per academic year. However, that tends to be far more than the average student actually uses. Our services like group therapy, drop-in workshops, and case management are all unlimited for students. And I think that gives you a little bit of an overview, particularly for families. I just wanted to point out that under the resources tab, if you go down, can't be in two places at once, we actually have a parent resource page. So just know it's down there. You can just page on down. But students can go to the resources tab also to find all kinds of self-led resources if they're more interested in doing meditation or relaxation training or even stress reduction types of skills from the comfort of home at their own time. We have several self-led resources that can all be accessed right through that tab. So that's just a little bit of an overview of what we offer. If students are interested in knowing who our counselors are, all of our counseling center staff for both of our offices are located on the About Us tab. So you can see not just a little bit about each clinician. I'm going to pick on Dr. Jones because she's right there. But you can also see a little bit of their clinical background, what some of their topic areas that they are most skilled at working with are, and just some kind of fun facts. So some of our students are more comfortable if they get to know the counselors before they make that first appointment. And this is a little bit of a way to do that.
Dr. Caldwell, I know that we will have time for questions at the end, but I did want to ask if you could share, if any of our supporters, their students are at the Liberty campus or they're a fully online program student, do they have access to all of these services? And what does that look like for those campus students?
Sure. So all of our students have access to our services, particularly now during COVID. Since the onset of COVID, all of our mental health services are offered fully through telemental health, both the individual sessions, workshops, and group therapy. So it doesn't matter where our students are located, they are able to access the same level of care that we can provide to students that are on one of the large campuses.
Great, thank you. So this is good information. I hope you can stew over it a little bit. For those of you that are in here, think of some questions that you may have, drop those in the Q&A feature as well. And I do think our first presenter has made her way back in. Oh goodness, technology. If COVID hasn't presented a lot of things. So I'm gonna welcome her back to share her screen.
I am getting a host disabled screen sharing.
You just got it. You should be good now.
Okay. All right, you all. Round two. I'm going to start here. I assume that I dropped out pretty early. So all of this information is on our website, and I'm sure that link will be dropped in the chat for you. But just know that our office is designed to be a prevention office. We take a public health approach in addressing well-being. We're here to support students. Counseling center and the health center typically are more of a treatment-based facility, even though they do offer some great workshops. Specifically, the counseling center, we partner often with them to host some of our workshops and primary prevention options. But we are here in order to help students create healthy behaviors and become knowledgeable, healthy, lifelong citizens, and reduce their health risks through risky behaviors. So like I said, we plan and host well-being programs. We also offer a wide range of peer education training. We have several options for students to be trained to become peer educators or be involved in our office, either as a Peer Body Project educator, as a wellness ambassador, and then we've just launched what we call a wellness champion. And we used a community-based participatory research approach. So we do partner often with academics in order to contribute to the field of public health so that we can create programming that addresses some of the needs of our students with regard to health and wellness. So here are some of our topic areas. I'll talk about wellness coaching a little bit more on the next slide. Mindful yoga is an example of one of those drop-in workshops that Dr. Caldwell pointed out. So we teach that together with between my office and a licensed therapist. The Pure Body Project, that is a empirically validated curriculum for primary prevention for eating disorders not otherwise specified, and also healthy body image. So that is an opportunity for students. We have 10 trained educators now. They go through a 2-day curriculum, and then they actually host our workshops peer-to-peer, and they have been incredibly attended even during the pandemic in a virtual format. We tend to have a waiting list along with what we call restorative retreats. Those are also heavily attended, and we offer that in collaboration with the Counseling Center as well. We'll offer a mindful yoga component. Potentially, we'll do some art therapy. We will do maybe a stretching clinic or myofascial release. We'll bring in foam rollers. So there's a wide range of options for students. We offer wellness weeks, which are engagement opportunities throughout the year. A lot of social norming. The Do Right campaign is an initiative out of our office. So if that sounds familiar, that's to promote COVID prevention practices. Condoms can be accessed through our office. And also healthy relationship workshops and a lot of collaboration between our campus partners. So wellness coaching has been heavily attended. It's a one-on-one guidance program that students can request a health coach on our website, and we cover a wide range of topics: sleep, exercise, nutrition, stress management, time management, tobacco cessation, and relaxation strategies. Depending on the needs of the student, we may bring in our dietetic intern, which is a student, a master's level student seeking to become a registered dietitian. So typically the coaching sessions will last anywhere from 2 to 6 sessions, depending on the needs of the student, and potentially even longer. Other engagement opportunities. So Wellness Ambassadors, that's our peer educator program. So that is our group of educators that are heavily trained in the broad spectrum of health and wellness. Then we have our wellness champions. So these are representatives from registered student organizations who are committing this semester to educating and promoting not just COVID prevention practices, but well-being practices overall. And they are being incentivized by receiving funding through their student organization for participating in well-being events. So if they, for example, were to go to a class at our rec center and they can provide proof of attendance, then we will drop some money in their registered student organization account to help to promote their well-being. We also have several virtual opportunities incentivized. So these buttons, you'll see that on our website. You can click through, see what our campus partners are. The students can join our listserv, and we send out weekly newsletters. Here's a student testimonial that I wanted to make sure was shared with our students from a wellness ambassador. So this is a student that has been with us for many years now. She's approaching her senior year at Georgia Southern and is has recently changed her major to be Master of Public Health. So we're excited to see where she goes and where she grows. This is our campus location information. So at the RAC, our office currently is at the Rec Center. It's the second floor on the Wellness Center. At Armstrong, we're in the MCC. And then, of course, our website, email, and phone number in order for parents or students to get in contact with us. So that's a little bit about student wellness and health promotion, and I look forward to questions.
Great. Thank you so much. It's a lot of great information, and I love that it's become its own office, and seeing all the great things that you're getting to do and implement with our students. So thank you so much. And of course, as I mentioned earlier, everyone, just like for Dr. Caldwell, drop some questions in the Q&A feature, and we'll make sure to ask those as we get to the end of our session today. But without further ado, of course, all these individuals are incredible partners on our campus, especially during these challenging times. I know an individual some people are very excited to hear from is Dr. Brian DeLoach, our University Medical Director. So I'm going to pass it off to him next.
Hey everyone, thanks for letting me be a part of this discussion. I'm certainly happy to be here and talk with you a little bit about the Student Health Center and the services that we provide. Just to give you a little bit of background about myself, I'm a board certified family medicine physician, no different than your family doctor would be back home. We have in the Statesboro Campus Health Center, we have two other board certified family medicine physicians, one of whom is also fellowship trained in sports medicine. And then we have several nurse practitioners and physician assistants who serve as our medical providers. We have a student health center on both the Statesboro campus and the Armstrong campus. We, as the student health center, are responsible for both of those operations. There are obviously some differences from both campuses. The Armstrong campus student health center, that operation is the providers there and the care they deliver is actually outsourced to the large hospital system in Savannah, Memorial Healthcare Associates, HCA. And so it's staffed with a nurse practitioner and some support staff there as well. I'm going to share my screen here in just a second and just go through highlight some of the things that we offer at Student Health Services, and then I'll jump to our webpage and kind of go through that just so that you're familiar with that. So let me see if I can successfully share my screen here. All right, perfect. Y'all should be able to see my PowerPoint. So at Health Services, we are accredited by the AAAHC. AAAHC is the accrediting association for ambulatory healthcare. So if you're familiar with healthcare at all, hospitals are accredited by an organization called the Joint Commission, or JACO. We are accredited by AAAHC. Not to toot our horn, but it's kind of a big deal. I think we're one of only two student health centers in Georgia that are accredited by AAAHC, and doing that holds us to a very high standard. We want to know that what we're doing is consistent with standard of care, is consistent with high quality care. And so it creates a lot of extra work on our part to be accredited, but we're glad to do that because we know that holds us accountable, and we're reaching very high standards with that. We are also recognized as a patient-centered medical home. So if you're familiar with that, the concept of a patient-centered medical home means that the patient is the center of the hub related to their care. And around that patient, they're surrounded by those services that support them. As a patient-centered medical home, we have to go through additional certification processes to do that, and we've built that into our practices. So we like to call ourselves our students' medical home away from home. Some students may spend their 4 or sometimes 5 or more years at Georgia Southern and never interact with us. Some patients may only see us once or twice for acute things like a stomach bug or muscle injury. And then we've got some patients that we see every month or 2 or 3 months, just like in a regular, medical office. Because, all of our medical providers come from a family medicine background, we take a family medicine approach to our care. That typically is a more holistic approach, but we provide the full gamut of care. And we tell our students that we're here to fill whatever role that they want to fill. If they only want to use us for those, episodic type things, that's fine. But we also do, chronic disease management. We manage patients with diabetes and hyperlipidemia and hypertension. We manage some, mental health conditions, those types of things. We also, for our patients who may have more complicated healthcare issues, for example, things like inflammatory bowel disease like Crohn's or ulcerative colitis, or some type 1 diabetics who are under the care of a specialist back home, we'll co-manage that and kind of, help coordinate care between them being able to manage their condition here, under the guidance of their physician back home. So let's take a look at what we've got here related to some of our specific services. So we provide primary care, women's health care. We have two women's health nurse practitioners and one PA who specializes in women's health, and we provide the full gamut of women's health care outside of obstetrics and surgery. So all of their primary care, breast, uro, GYN care, we're able to provide that. Psychiatry, we actually have a psychiatrist who is contracted with us who provides psychiatry services 2 days a week. Like Dr. Caldwell mentioned earlier, those services are currently done primarily through telehealth. But when we see a student who we feel like is not responding to the mental health care that we're able to provide within our scope of practice, then we're able to elevate them up to the psychiatrist for a little bit more directed care. We have lab services in our facility on the Statesboro campus and on the Armstrong campus. And then we are also contracted with a reference lab so that if there are certain things that we need to send out, we're able to do that. We're able to, on the Statesboro campus, we're able to perform x-rays in our facility. And all of those films are overread by a radiologist. For the Armstrong campus, if the student needs an x-ray, the providers there are able to coordinate that through resources in the local area in Savannah. We have a pharmacy on the Statesboro campus and have a pharmacist, and we're able to stock the things that would be germane to students' healthcare here. Students who have prescriptions prescribed by their medical provider back home can have those transferred here and get them filled here. We're able to prescribe and send those scripts to our pharmacy here, but we can also send to any other pharmacy. And I would say it's probably about half and half. Half of our students use our pharmacy, half want it to be sent to a local retail pharmacy. Sometimes that's insurance driven. For students on the Armstrong campus, that medical provider there is able to send their prescription to any of the local pharmacies in that area. We have optometry services on the Statesboro campus with an optician or an optometrist and 2 opticians able to provide really the full gamut of optometric eye care for our students. And I will make a note that our students on the Armstrong campus are able to use any of the services that are on the Statesboro campus as well, if they elect to do so. We also provide allergy shots, immunizations, have numerous patient support services, and then we also do travel medicine consults. As far as appointments go, both on the Armstrong campus and the Statesboro campus, we work on an appointment system. We're not an urgent care center, and so we ask that our students schedule their appointments in advance. All of our students have access to what's called Eagle OSH, or Eagle Online Student Health. They are able to use that to schedule appointments with the Statesboro Campus Health Center. On the Armstrong campus, they have access to a system called MyChart, and they can schedule appointments through there. So they'll schedule their appointments in advance and then come in for their visit based on that. We use what's called a rolling 24-hour advanced access scheduling model. What we found is that the majority of our students, when they want to be seen, they want to be seen either today or tomorrow. And in the past, our schedule was wide open. They could schedule as far out in advance as they wanted to. And what we found is if they scheduled beyond about 2 days, the likelihood of them no showing for their appointment was significantly higher, either because they got better but by the time their appointment came, or they ended up being seen somewhere else. The way our system works is when they go in to look for an appointment, it's going to show them all appointments that are available over a 24-hour period starting at the time that they've logged in. If they don't see an appointment that suits them, they log in an hour or 2 later and it shows them an hour or 2 more of appointments. But by doing that, our no-show rate dropped drastically, and that suits that desire for most of our students that they get an appointment within a day or 2. there are going to be times when an appointment may not be available, and that's no different than in your regular doctor's office. And so there are several urgent care centers that are within a 5 or 10 minute drive of each campus in each location. And so our students are encouraged that if they feel like they have a problem and the appointments that we have available aren't going to suit that, then we encourage them to seek care off campus if they feel that's necessary. They can also use their online portal to send us secure messages. It's fully HIPAA compliant. We use that portal to communicate with them information about their appointment, patient education documents, their lab results, so on and so forth. And I'm sure you all know they most of them, and I hate to generalize, certainly don't answer their telephone when you call them. They do a pretty good job about responding to the online student health messages. Texting is probably the best way to get in touch with them at this point, though. Right now, like Dr. Caldwell mentioned a minute ago, because of COVID, we've seen significant changes in our operational model. We shifted immediately to a telehealth model back in March, and we've remained that way since then. So any appointment that a patient schedules through their online portal is going to be a telehealth appointment initially with one of our providers. And I'll share with you the same spiel that I tell all of our patients when I have a telehealth visit with them. I say, in a lot of ways, a telehealth visit is very similar to an in-person visit. I can see you, you can see me. There are certain parts of your exam that I can do just by looking at it through the video. But obviously there's some differences. You're there, I'm here. I can't listen to your heart and lungs with my stethoscope, can't look inside your ear with my special light. I can't put my hands on you to do certain parts of the exam. So as such, there's going to be some things that we're able to treat or diagnose and treat completely off of the telehealth appointment. But then there's going to be some things where that's not appropriate. And after the telehealth visit, our decision is going to be, hey, we think you need to come in for an in-person visit. And in those instances, we're able to schedule them for an in-person visit, usually that same day or the next day at the latest. Then they come in and they see one of our providers who's seeing patients in person at that time. That process is in place both on the Statesboro campus and the Armstrong campus. With regards to COVID patients with COVID symptoms, which I'm sure you all know by now, that list is very long and is all the same symptoms of a flu and a cold. If a patient has those symptoms and after their telehealth visit, we feel like it warrants an in-person visit for a chest exam or whatever, then we'll schedule them for an in-person visit. But in the Statesboro campus, we actually see them in a separate part of our building because the campus here is much larger. We have a much larger student volume here. It's a much bigger facility. On the Armstrong campus, they spread their appointments out. So you're not mixing sick patients with well patients. And that process has worked well. We anticipate that we'll continue with that process in the spring. Literally, we reevaluate things week by week. As much as we would all love to go back to traditional in-person visits for everyone, for the time being, we see us continuing to function in that same model. With regard to COVID testing, and I know this is a big question for everyone, at the health center on both the Statesboro campus and the Armstrong campus, we have testing available for those students that we see for an evaluation with symptoms. So we're able to test symptomatic students. We have the rapid test available in both student health centers that gives us a result within about 15 minutes or so. If we need backup backup testing, we're able to send that out to a reference lab, and we can do that from either one of our campuses. And then we can also send tests directly to the Department of Public Health. In addition to the testing that we do on our campus for symptomatic students, in all of our campus communities, there are options for testing through the DPH testing centers. And I'm sure you're all familiar with that. And anyone can get tested there, whether you have symptoms or no symptoms. So that information is available. I've put the link here on the PowerPoint to a web page on our site that has specific testing information available for each campus location. That gets updated as we get new information from our Department of Public Health partners. Our website is very robust, and in just a second, I'm going to try to switch my screen over to that website and show you that information. But Obviously, there's a lot more information there than what I can share here, but I'll kind of walk you through a few things there in just a second. And that's just our information. That's our email and our phone numbers there on that slide. So let me see if I can navigate over to our webpage real quick. We got that? Y'all able to see our webpage? Okay, perfect. So if you go to our webpage, you'll see that we have information links there about student health insurance. So on the Statesboro campus, we do file insurance in our Statesboro campus location. On the Armstrong campus, like I mentioned, that's outsourced to one of the large health systems there. They don't file insurance, but they will provide a walkout statement so that you could file that to your insurance on your own, and then they would provide any necessary documentation if that was needed. Information about immunizations can be found on our website. Information about how to schedule appointments. There's videos that walk our students, through that process. And then there's links here for each campus that kind of highlight the similarities of what is available for care on each campus, and then point out a few important differences there. There are links here on our page for after hours care. We're open Monday through Friday, 8 to 5 on both campuses. When the university is closed, we close. But there are times when classes aren't in session, but the university is still open, and will be open during those times. But if you go to our emergency and after hours care page, you'll see information for urgent care, hospital emergency room locations on both campuses. Additionally, after 5 each day, and on the days when we're closed, we have an after hours nurse call line. So if a student calls in, they'll get a recording that instructs them how to connect with a nurse. That's an RN triage line, and they'll speak to the student and tell them, hey, I think you need to go to the emergency room now, or this sounds like something that can wait. Reach out to the student health center in the morning. We get a log of all those calls each morning, and then we reach out to students when that's necessary. There's links here about how to join the telehealth appointment. And then over on this side under news, there's a link to our webpage that goes into very great detail about COVID testing options in our communities where our campuses are located. So that's a pretty quick overview. We have a lot to offer our students. What we find a lot of times is, hindsight is always 20/20. We routinely hear back from our students after they've left Georgia Southern. Hey, doc, I had no idea how good I had it while I was there. The services y'all offer are very comprehensive. It's so much more affordable than it is out in the real world. Y'all are so much easier to work with. One of the things that we really try hard to do for our students is educate them so that they can become knowledgeable consumers in the healthcare system. And so we do more hand-holding early on, but over time, we'd like the students to become, really the center of that patient-centered medical home hub. Let them be responsible for their care, help them learn how to advocate for their care, because they're going to need to do that when they get out in the real world. There's not near as much hand-holding as I'm sure you all are aware. So thanks again for giving me the opportunity to go over that, and I'll be happy to answer or do my best to answer any questions that may come up.
Great. Thank you so much, Dr. DeLoach. We actually do have one of our first questions is for you. So what determines whether there is a charge for health services beyond the semester fee that they pay?
Yeah, so if you'll go to our, that information is there's a lot of information on our webpage about that. So if you click on I think if we go to the Statesboro campus link and eligibility and fees, it really goes into detail what is covered by the fee and what's not covered by the fee. So I tell students that think of the health fee as an access fee. That gives you the ability to access our services. And then there are some things that we're going to be able to do that we don't charge for, that you typically would be charged for in a regular doctor's office visit. And then there are some things that we are going to charge for, but that fee is going to be steeply discounted compared to what you might see in a regular doctor's office visit. And so that student health fee really helps offset some of those other costs so that we can drive it down, and make it within reach, for our students. All students who are enrolled in at least 4 credit hours will automatically pay the health fee associated with the campus that they're on. For online students and for Liberty campus students, they aren't automatically assessed the health fee, but they can elect to pay the health fee if they want to access those services.
That's great. Thank you. Another question that we received was, does Georgia Southern offer testing for ADHD, ADD, and other things like that?
Excellent question. I think that's also embedded on our webpage. I won't waste a lot of time trying to find that, but the short answer is yes. If you'll bear with me for a minute, I'll kind of talk through that process. So through the Student Health Center, what we do is, if a student reaches out to us and says, hey doc, I'm concerned I might have ADD or ADHD. I've been having trouble focusing or concentrating, or, I procrastinate, whatever. Or I filled out this online little screener and I screened positive for ADD or ADHD. I just want to know what's going on. At that initial visit, we'll talk with the student, and I explain to them, first off, we don't diagnose ADD or ADHD. What we first do is evaluate those symptoms, because all of those things that those students are noticing are symptoms, and they could be symptoms of a primary attention deficit disorder, but they could be symptoms of other things like a mood disorder, disturbance, a sleep disorder, a substance abuse problem, those types of things. So we'll talk with the student. We have a screening instrument that we use that they'll fill out for us. And then at the end of that discussion, we kind of make a determination of whether we feel like there's a considerable likelihood that their symptoms could be due to ADD or ADHD. Or we might say, look, this is obviously something else, and we need to address these problems first. In those instances where we feel like it could be due to ADD or ADHD, then we work to link the student with local resources that can do a formal evaluation to determine if that's an appropriate diagnosis. For us to treat ADD and ADHD, we have to have documentation that a formal evaluation has been done. That formal evaluation can be by a psychiatrist, a psychologist, a licensed counselor. Sometimes in primary care settings, what's done is parents and teachers fill out some assessment forms along with a school counselor, and then a physician reviews those, and then comes up with a diagnosis. So what we'll do is we'll link the student with that resource. There are on-campus options for having that evaluation done, and then there are off-campus options. And so we'll provide them those options, let them know what direction they want to go. Once they have that evaluation done, if it is consistent with a diagnosis of ADD or ADHD, then we will we'll treat that. Sorry, I don't know why I'm stuttering. We'll treat them for their ADHD. We'll initiate medication and then follow them, throughout the course of their treatment. And we do have the first line treatment for those problems is typically stimulant medication, which is a controlled substance by the Drug Enforcement Agency. So there are very stringent policies and rules that have to be followed, as we manage those patients, and we go through all of that with them. We actually have a treatment contract that we have them review and sign, with us when we do that. If their evaluation says, hey, this isn't ADD or ADHD, we think this is a mood disturbance or a learning disorder or some other problem, then we link the student with a resource that can best address that for them.
So you are the popular one right now, and I'll have some questions from our other panelists in just a moment. But one of the questions we just received, it's probably too early to have, but is there a plan for providing vaccinations for COVID to students when it's available to the public?
That's a great question. Those plans are in progress. We don't have all of the details nailed down yet, but we are working towards an ultimate goal of being able to provide vaccine to our students, faculty, and staff. That's a very cloudy crystal ball that we're peering into. There's, every day we get conflicting information about, how that's going to roll out. But we are moving in a direction that we would like to be able to do that.
Great. And the other question was, do any of the service areas on our call this evening offer chiropractic care for students?
So that's a great question. We don't offer chiropractic care. We do have a physical therapist in the Statesboro Health Center, though, and we routinely refer to them. For our students who prefer a chiropractor, then we will work to refer them, off campus if that's what they want to do. Now, anytime we do refer a student off campus, whether it's for a chiropractor, or let's say they have a, fracture, they need to see an orthopedic surgeon, or they have some gastrointestinal issue and it's beyond the scope of what we, can evaluate here. Anytime we do that referral off campus, then the student's going to be responsible for, any costs associated with that. That's one of the reasons that, we like for the students to have their insurance information with them if they do have insurance, because that can help facilitate that referral and make that process much easier.
Great. Thank you, Dr. DeLoach. So one of the questions we have is for health and wellness promotion. So you mentioned your peer-to-peer leaders. Are those paid positions or volunteer? And when do those typically get recruited in case any of their students are interested?
So our wellness ambassadors, that's a great question. Our wellness ambassadors are unpaid opportunities for students to engage with our curriculum and become student leaders. We do offer internships in fall, spring, and summer. Those are technically unpaid, but we do have opportunities where we can provide stipends for them through grants. We actually obtained one this year for one of our interns. So we accept applications for internships and for wellness ambassadors for both campuses, Armstrong and Statesboro. And of course, Liberty is an opportunity. Students can definitely participate in either of those opportunities on a rolling basis. So I believe that the link was dropped to become a wellness ambassador. And then if students are interested in an internship opportunity, they would email wellbeing@georgiasouthern.edu their resume.
Great. And do you have any advice? We're talking about, we know that wellness is incredibly important and can impact our students' grades as well as how they're taking care of themselves inside and outside the classroom, right? So any advice for how our supporters can support their students in this, whether they're with them at home right now or from afar? How can they kind of help their students promote their health and well-being?
I definitely recommend continue to check in with your students. Any encouragement that you can continue to send with them does wonders for their mood and their self-care. Remind them how important it is to take care of themselves, to not procrastinate, know your deadlines, and avoid the stress that is more so self-inflicted from procrastinating and remembering time management, etc. I'm sure all of you remember what their study habits were during high school, and there are plenty of options on campus that can support them otherwise. So also encourage them to seek help. Help-seeking behaviors is definitely self-care and one of the most important things that students can do in order to take care of their well-being, and remind them that it's preventative, but it's also very treatable. So anything that they're doing ahead of time in order to make themselves feel better is wellness. And then anything after help seeking is also still wellness.
Great, thank you. Dr. Caldwell, are there a max amount of appointments that students can do in the counseling center, depending upon what service they may be seeking?
So there's not an overall maximum number of appointments students can have. We do have a limit of 16 individual sessions per academic year, and that's just purely a staffing issue. So there's a lot less of us than there are students. But like I said earlier, most of our services are unlimited. Everything except for individual counseling is unlimited. So if a student wanted to, they could be participating in counseling center services every day of the week throughout their entire academic career, between our workshops, groups, individual counseling, solution sessions.
Great, thank you. Well, I don't see any other questions. And of course, I'll do my shameless plugging again to give you an opportunity to drop questions in the Q&A feature if you have them for the end of our sessions. But of course, thank you to our panelists and to Shivani Patel for being in the chat for us and dropping you all those great links. So as I mentioned earlier, this is our last Zoom session of the fall semester, but you can catch us going live on Facebook on the Georgia Southern Family Programs page before the holiday season, just to connect with you and chat and hear about things that we can do to continue to support you while your student is with us at Georgia Southern. So definitely check us out there. We are also going to continue planning Zoom sessions like this throughout the spring semester, once a month at least, and maybe a couple extras sprinkled in there based on some feedback we've been receiving. So please make sure you connect with us. Let us know what you want to hear about and know that we're here to support you. So without further ado, if you don't have any other questions, anything that we can help with this evening, thank you for joining us. We will hang out on the call in case you have any questions that you need to drop in the Q&A feature. But we hope you have a great evening and let us know if we can support you. So thank you so much.